Hello everyone, this is Chadi Alraies from SCAI 2022. With me is Dr. Marvin Eng. He is Director of Structural and Banner University Medical Center. Dr. Eng, this is SCAI back in life and in person, and you're going to talk to the audience about surgical valve and the mitral space that failed and what are the transcatheter therapies are.
That's correct. I think nowadays we have the commercial availability of balloon expandable valves from the SAPIEN 3 generation that can treat both degenerated bioprosthetic valves and degenerated surgical mitral repairs. So now that we have those things available, there's a lot of dissemination across the United States, a lot of generalizable data. So I'm going to give a talk that discusses an update of the current survival, current complication rate, as well as a lot of the nuances, because both the procedures are, even though they're similar, they have a lot of important differences, especially valve and ring. Because valve rings are very nuanced. They have different shapes, they have different composition, and they have some are complete or some are incomplete. And you can see if you look at across several registries like the VIVID registry or the TVT registry, there's higher complication rates for valve and ring procedures with respect to things like paravalvular leak, LVOT obstruction, the need for a second valve. And as such, it's important for operators to appreciate the differences in valve and ring, and not just to extrapolate what they think they know from valve and valve to valve and ring.
So it sounds like it's the mitral space completely different than the aortic space. It's not that straightforward. There's something you have to study, evaluate what kind of valve before you go after it.
Absolutely, and a lot of it's related to what we've kind of learned about pre-procedural preparation and evaluation with respect to anatomy, whether or not there's enough space for prosthesis. The prospect of left ventricular outflow tract obstruction is very important, and because of the anatomical position of the anterior mitral leaflet, when you put new valves in the mitral position, that can encroach on the LVOT and cause obstruction. And because of the necessary tools to do rigorous screening, that really changes or makes this procedure more complex.
And this preparation and LVOT and new LVOT with an NEO management. So imaging sounds like it's a key thing.
Absolutely. So it's very important that you have a very solid foundation with respect to your CT analysis, and that your intraprocedural imagers are very seasoned, because there are a lot of things like detecting the paravalvular leak, making sure you have precise transeptal location, and even live monitoring during your valve deployment is very important.
Please watch this video and others on SCAI-TV. This is Chadi Alraies from Atlanta. And thank you again.
All right. You're welcome.
Perfect.
Thanks.